Hello, everyone. Welcome to today's webinar, and thank you for joining us for the Health Information National Trend Survey, HINTS 5 Cycle 3 Data, a how-to guide for using the new HINTS data in your research. My name is Stephanie, and I will be your WebEx host. So before we move into introducing our speakers for today, I'd like to make a few comments before we get started. All lines have been muted upon entry and will remain muted for the duration of the webinar. You can submit your questions throughout the presentation using the Q&A or chat panel and select all panelists from the drop-down. We will ask these questions on your behalf during the Q&A portion of the webinar. Should you need to view live captioning, please refer to the Media Viewer panel. This webinar is being recorded and it will be posted online in the near future. And now I would like to introduce our speakers for today. Rick Moser is the Training Director for the Division of Cancer Control and Population Sciences and Research Methods Coordinator for the Behavioral Research Program at the National Cancer Institute. In addition to these roles, he is the Chief Methodologist for the HINTS program, and he has been part of the HINTS management team since 2003. Ashley Murray is a Cancer Research Training Award Postdoctoral Fellow in the Behavioral Research Program at the National Cancer Institute. Among other roles, her work primarily supports the HINTS program. Thank you both for being here today, and we'll go ahead and get started.
Okay, thank you everyone, and thank you Stephanie. Can everybody hear me okay? Okay, great. So first of all, thank you for participating in today's webinar. And I hope everyone is staying safe and healthy during this crisis. But again, thanks for joining us today. Okay. So I wanted to just give you a little background about HINTS and how it was developed. As many of you know, we live in a rapidly changing communication environment. So once we used to have rotary phones and fax machines and flip phones, and by the way, I'm old enough to remember rotary phones. We now have smartphones, Fitbits, wearables, and virtual reality. And because of that, because of this changing environment and because of the importance of communication, health communication on health, we decided, and the NCI, the National Cancer Institute, put together a meeting in 1999 where we gathered together many experts. And from this, the HINTS, the Health Information National Trend Survey, was born. I'm going to give a little HINTS history and timeline here to kind of give you a little kind of fill you in, and hopefully this kind of isn't too hard to read. Across the top there, you can kind of see all the different HINTS iterations from HINTS 1 up to HINTS 5 that were actually, these are surveys that were directly sponsored by the National Cancer Institute. And going kind of from left to right, again, we can see the timeline in the middle there. And what originally HINTS 1, 2, and 3 were done kind of biannually, basically every 2 years. And just to give you a little methodological information, the first HINTS surveys were done over the telephone using random digit dialing. And then we slowly moved to HINTS 3, where we kind of did a dual frame. We did half the survey was done with telephone on the telephone with a random digit dialing, and half of it was done with a postal sample, that is using U.S. addresses, and then a self-administered survey. And because of the response rates that actually seem to improve by using a postal survey and a self-administered survey, we then moved for HINTS 4 and HINTS 5 to a postal frame. So again, we start with U.S. addresses and then randomly pick from that. You can see HINTS 4 had 4 cycles. And at this point, we moved to more of an annual survey, thinking that, again, because things are changing so quickly and rapidly, we really need to kind of keep up with that. So you can see 4 iterations of HINTS 4. You can see the sample sizes for each one of those also. You can also see a survey we did with FDA, with our colleagues at FDA, the Food and Drug Administration. And with HINTS 5, which started in about 2017, again, you can see we're going to do 4 cycles of HINTS 5. We also did another survey with the FDA around the same time as HINTS 5 Cycle 1. And again, you can see the sample sizes. And of course, now what we're going to be talking about today is HINTS 5 Cycle 3. Of course, the data are available, and I'll tell you about where you can find the data. And then, very importantly, HINTS 5 Cycle 4 is currently in the field, and those data will be available approximately fall or winter of 2020. I should also point out on the bottom there, you can see some other kind of offshoots of hints, either done at a state level, or particularly Puerto Rico did it as a U.S. territory. And again, you can see some other efforts that were done, some of them international, like in Hong Kong and China. Now, these aren't necessarily official HINTS surveys, but they use HINTS items. So we're very excited to see that because, of course, it really allows opportunities to make comparisons across surveys and these kinds of things. So we do encourage people to use the HINTS items where possible. Okay. For those of you new to HINTS or want to find out more information about HINTS, I highly suggest you go to our website. You can see the URL at the top there, hints.cancer.gov. And actually there you'll find a lot of different information. Not only can you get all the HINTS data and supporting documents, and we'll reiterate this a couple times, but you can get the data in SPSS format, SAS, or STATA. Again, we provide a lot of supporting documents so you can use the data. And that was really one of the goals of the HINTS program, is to allow for people to access the data very easily and use the data very easily. Also at the website, you'll see our electronic code book. This is basically, again, it's kind of an online version of HINTS. You'll see every item that's asked. And people seem to like this because what's nice about it is it allows you to look to see where the same item was asked over multiple iterations of HINTS. That's a nice way, maybe if you want to do a trend analysis or look to see exactly what you want to study in your research. We do have a how-to HINTS tutorial, which is a set of videos. If you are really new to HINTS, I may suggest that you start there. Again, it's a series of tutorials, videos that we did a couple years ago, but it gives a lot of background about HINTS. We talk about methodological issues, and we have some use cases. We show some studies that were done using HINTS. We have several reports, many of them statistical in nature, talking about how you combine the data, how you merge the data. So I highly encourage that if that's of interest to you. We have a list of publications, so current publications, which is kind of nice to see. You can maybe take a look what has been done before, maybe make sure your study isn't going to duplicate what's already been done. Also, I should mention there we have a list of all the journals that have accepted HINTS publications. So that can be a nice way to find out, okay, yeah, here's some journals that we know are friendly to HINTS publications. And the last thing I'll mention is we have our HINTS briefs also on their website. And this is really just kind of a summary of some particular topic based on some published HINTS literature. And for example, I can tell you our latest brief, brief number 41, is all about palliative care awareness among the U.S. public and among caregivers, because that's one module we have. HINTS, a recent module about caregiving. Okay. Now let's talk specifically about HINTS 5, Cycle 3. That's why you're all here today, in many ways. Like always, the population for HINTS is the U.S. non-institutionalized adults 18 and older. So that does not include people who like prisoners or people in nursing homes. So again, people who are not in some type of institution. The survey was conducted from January to April of 2019, so it's nice and fresh data. Westat is our main contractor for this, and so they've been working with us for many, many years. And you can see our total sample size is 5,438, and actually that's a bit larger than typical iterations, at least most recently, which mostly around 3,500. And you may say, well, that's interesting, and that's actually that's good news in many ways, and it kind of and I'll talk a little more about why that's the case. Let's talk about the content of HINTS. Especially for and I'll talk about some things that you kind of the core parts, and then some new items we've added. So kind of the core HINTS, we always ask, these are, which takes about 50% of the survey, is our typical health information, health communication, health seeking items. So we ask people, have you ever looked for health or information about health or medical topics? Have you ever looked for cancer information? How much do you trust the different sources of the information? And what was your experience like when you were seeking that? Was it easy to find? Was it frustrating? These kinds of things. And I can tell you for HINTS 5 Cycle 3, there was more of a focus on looking for health, information on health or medical topics. And then we typically kind of go back and forth where we kind of drill down between health and medical topics versus cancer. But we always ask in every iteration, if you ever look for cancer information. But again, for this iteration, we just drill down a little more on looking for health or medical information. What other content we have here is on the use of wearables. Do you use wearables? How often? Are you willing to share the data from using your wearables? We also ask about using medical devices like glucometers, blood pressure instruments, those kinds of things. Some other new content is about use of urgent care. So we asked some questions about that. How many times have you visited an urgent care in the last 12 months? And what do you feel is the quality of the care that you received in an urgent care center? We've oftentimes asked about alcohol and alcohol use, but we do that again. We're going to ask some questions about some new questions related about your perceptions of the relationship between alcohol use and cancer, and also other diseases like heart disease or diabetes. And have you had discussions with your doctor about the connection between alcohol and cancer? Another behavior we're very interested in looking at here is sleep. So we ask people about their quantity of sleep, their quality of their sleep. We also ask, are you kind of a morning or a night person? Kind of, again, looking at those kinds of issues. And then maybe the last thing I'll talk about, but as far as some new content, is about sun safety and specifically around sunburns. This is an issue that we know is important, especially obviously related to skin cancer. So we ask questions about how many times have you had a sunburn in the last 12 months? What were you doing when you had the sunburn? Were you working? Were you with friends? Were you sunbathing? These kinds of things. And we also ask questions about, were you doing other things when you were sunburned? For example, were you wearing sun safety clothing, these kinds of things, or were you drinking alcohol when that happened? That might be of interest to many people. All right. So what makes HINTS 5 Cycle 3 unique is the web pilot study we did. And that's actually one reason why you see such a larger sample size. What was really kind of cool about HINTS 5 Cycle 3 is we tested a multi-mode survey. As I mentioned, previous iterations have been a self-administered mail survey. You get it in the mail, you fill it out on your own, and then you return it to us. But we're always trying to improve the data quality. That's always something survey methodologists are interested in doing. So what do I mean by data quality? So the most obvious one is to increase the response rates. In other words, increase the percentage of people who receive the survey actually return it to us, because that's always an issue, and that's an issue not only with HINTS, but any kind of national health survey that's out there. We want to increase response rates. We want to increase coverage. Historically, HINTS has had a problem getting people like males. They tend to underreport, or people with lower levels of education. We also want to kind of reduce undesirable respondent behavior, as we like to call it, either non-completion, people don't finish the whole survey, they skip items, or speeding or straight lining. Speeding when people kind of rapidly go through the items and answer them very quickly, or they straight line, literally just kind of maybe just putting the same answer across a number of items, which suggests they're really not kind of putting the cognitive effort into it to kind of really think through the items. So we want to kind of reduce those kinds of behaviors. Of course, we want to assess the cost effectiveness of doing potentially a multi-mode survey. And so the mode that we're adding was really adding a web option. So on the right-hand side here, you can see that every HINTS respondent was randomly assigned into one of three groups. Either what we call the paper-only group, that is, you received the survey in the mail, and that was your only option, but to return it in the mail. Then there were two other groups. And I should mention, everybody received a survey in the mail. Certain groups, one of them was called the web option group, was given the option of answering the survey on the internet. So of course, they were given a URL, and it was a unique number, and all these kinds of things. The third group was the web bonus group. So again, they received it through the mail, and not only were they given an option to do it on the web, but they actually were told, oh, we will actually give you $10 to finish it on the web. So again, kind of looking at those three groups. Very importantly to mention that we have random assignments of respondents to three groups. I should mention that everybody got a $2 incentive in the mail. But again, obviously the web bonus group got the $10 extra when they answered it on the web. Very importantly, it's important to point out, and I think I'm just saying this, that the web groups could answer on the internet, or they could return it by mail. So that's kind of an important thing to mention, and I'll go into a little more detail about that, kind of the ramifications of that. Those who did complete it on the web were actually randomly assigned to either get prompting or no prompting. And when I'm talking about prompting, I'm meaning for either speeding or straight lining. That's kind of the nice thing about doing a survey on the internet. You can do things like look to see, how long does it take them to answer any one question. And Westat created this nice algorithm where they said, well, if it seems like it's too fast, we're going to give them a little prompt to say, hey, it looks like you're kind of going through this too quickly. Are you sure you're taking the time you need? And the same thing with straight lining, where they could kind of detect the same answer over multiple questions, and again, could be prompted to say, well, maybe are you sure you're kind of really thinking this through? Very importantly, each of these three groups can be considered as independent samples from the same population being adults 18 years old in the U.S. And very importantly, you're going to see weights associated with each of the three groups. When I say the weights, I mean a final sample weight to get your population point estimates and a set of 50 replicate weights to get your correct variance estimates. And I know Ashley's going to talk more about that and how you decide which weights to use. All right, I'm going to wrap things up here. I did want to talk a little bit about some of the results from the web pilot. One thing, of course, we're very interested in was response rates, and did we see any difference across the three groups? And I guess this table not only shows that, and again, kind of cut to the punchline here, there really were no statistical differences between response rates. They're about the same, so no statistical differences. So we were a little disappointed in that, but again, that could be a good news or bad news kind of thing. And actually, I think the other thing that this table shows is the sample size of each of the three groups. And again, that's kind of the nice thing. You can think of these as independent samples. So you could analyze each of these independently or potentially look at the total sample of 5,438. And again, I promise Ashley's going to go into much more detail about that and how you kind of helped decide to do that. The last thing, one other thing I want to mention real quickly is some other web pilot results that might be of interest. And again, hopefully sets the stage for Ashley's talk. And one, actually, the one important difference is two things I want to mention. First of all, did we see any demographic differences? Now, when I say differences, I'm talking about differences between the groups. In other words, the paper-only, web option, or web bonus group. And actually, it turns out people who did on the web bonus group tended to be a little younger, and I think we got some more males there. So that was some good news as far as getting some of those people that we had trouble getting previously. And the other thing we could test for were mode differences. Did you see mode differences between people who answered it on the internet versus through the mail? And in that sense, you did see some mode differences. Those people who answered it on the web tended to be younger, male, little higher education. Some of that would probably be expected. So that's kind of nice to see that, yes, maybe we did increase some of that coverage, some of those coverage concerns I mentioned a little earlier. Again, maybe we're getting more of the males, these kinds of things. And that's always a nice thing. We want to increase as much coverage as possible. Very importantly, and again, most importantly for when Ashley starts talking saying her part, is do you see differences in the outcomes? Again, any of our items, do you see differences in the percentage of people who answered, agree with this or, kind of have this perception or that perception? And what I'm going to tell you is one thing is you're going to want to look at the Web Pilots results report. That's what you get when you download the data. Because we're going to tell you that's one thing we want you to do is look to see, do you see differences by group in these outcomes? And the answer is yes under certain circumstances. And that's going to be something you're going to need to control for or think about as you decide to which set of weights and which sample you decide to use there. Another question may come up is, well, did we see mode differences on some of these outcomes? And the answer is yes, but it's hard to really kind of understand mode differences per se, because you have to keep in mind that there's basically it's about mode differences from selection effects. In other words, yes, people had a choice to do it on the internet or on the paper. It's the web bonus or the web option group. So it's kind of really hard to tease out mode differences from selection effects. So what we're going to be focusing on now, and what Ashley will be definitely focused on, is more outcome differences between your groups. So we're less concerned about mode differences because there's really not much we can, it's hard to kind of tease those out. But certainly you want to be assessing helps you decide which sample you want to use, corresponding weights. All right. Done now. I am going to turn it over to Ashley, and then I'll come back at the end when we Q&A session.
Great, thanks. All right, thanks, Rick. Hi, everyone. Okay, so now I'm going to be discussing how to conduct analyses using HINTS 5 Cycle 3. So HINTS can be analyzed using a variety of programs. And because of the complex sampling procedure of HINTS that Rick already discussed earlier, it's important to consider which program you use whenever you're conducting inferential statistics or calculating anything that involves calculating a p-value or a confidence interval, or whenever you're trying to calculate population point estimates. So if you don't use a program that can consider these issues, the issue is that your standard error in your analyses will most likely be underestimated if you don't take into account your sampling procedure. Therefore, your p-values will be smaller than they should be, your test will be more liberal, and you're more likely to make a type 1 error. So if you're wanting to conduct inferential statistics, a program should be able to compute the variance estimates when analyzing survey data that employ a complex sampling method, such as hints, and they should be able to analyze the data using jackknife replicate weights or Taylor linearization. Programs that can incorporate replicate weights include SAS, Stata, Sudan, R, and WestVar. And programs that can use Taylor linearization include SPSS and SISTAT. So within the overview of the HINTS 5 Cycle 3 Survey and Data Analysis Recommendations document, you will find code and results for SAS, SPSS, and Stata. And this is going to be done for a variety of different analyses, including descriptive analyses, chi-square, logistic regression, and linear regression. And in SAS and Stata, we will do this using both jackknife replicates and Taylor linearization. SPSS, however, can only use Taylor linearization, so we only provide the code and results for Taylor linearization across all of the analyses in SPSS. SPSS analyses use a complex samples module, which is actually an add-on to base SPSS. So I'll show you how to check your SPSS to see if you have this complex samples module. If you don't have it, then you'll need to switch to a different program that can incorporate either jackknife replicates or Taylor linearization, or you'll need to get the complex samples module add-on. If possible, we suggest actually using a program that can integrate jackknife replicate weights. Today's tutorial will actually be highlighting both SAS and SPSS because they are the two top downloaded data packages within HINTS 5 Cycle 3. So within the data files, you will find 5 sets of replicate and final sample weights that correspond to the random assignment into the 3 experimental groups that Rick discussed earlier. That includes the paper only, the web option group, and the web bonus group. And then the other 2 sets of final and sample replicate weights are for the total sample controlling for group and for the total sample without controlling for group. If this sounds a little bit overwhelming, don't worry too much about that. We've created a nice little flow chart that is found in the overview of the HINTS 5 Cycle 3 Survey and Data Analysis Recommendations document, which is in every data package download. And here is that flow chart. Over the next couple of slides, what I'm going to be doing is walking through this flow chart. So the first question that you need to ask yourself is, are my variables of interest measured in the Web Pilot Report? As Rick already mentioned, you can check out the Web Pilot Report and see if your variables of interest are measured within the Web Pilot Report. However, if you're like me, your variables of interest are not in the Web Pilot Report. So what you will need to do is you will need to conduct analyses to assess for group differences yourself. And we actually do suggest that everybody does this. So you would do this using the NWGT weights. So now what I'm going to do is I'm going to walk through the SAS code to show you how to assess for group differences. So as I mentioned, it's strongly recommended that analysts first assess for possible group differences within their target variables. First, what you would need to do is you would need to set your negative values to missing within a data set function within SAS. Next, I'm going to walk through an example using Proc survey logistic because I'm going to be looking at a categorical outcome variable, seek cancer info. But if you notice below, there's also code for a linear regression using Proc survey reg, which follows very similar steps. So next what I'm going to do is I'm going to select my variance method, which in this case, my variance estimation method is jackknife because I'm using SAS. It can incorporate jackknife replicate weights. We do suggest that you use jackknife replicate weights if your statistical program can incorporate them. Next, I'm going to select my final and replicate sample weights. So under weight, I will put my final sample weight, which is NWGT0. And I will also next put in my replicate sample weights, which are NWGT1 through NWGT150. If you're questioning how you determine how many replicate weights will be used, the way that you calculate how many replicate weights are used is by taking 50 times the number of groups. Because we're conducting analyses to assess for group differences, we're looking across the 3 different experimental groups. So 50 times 3 is 150. Next, we need to calculate our denominator degrees of freedom and put that into our code. To calculate your denominator degrees of freedom for your replicate weights, you would take 49 times the number of groups. Since it's 3 groups, we would do 49 times 3, which is 147 denominator for our denominator degrees of freedom. Next, we will need to make sure that we have a class statement that targets our grouping variable. Within HINTS 5 cycle 3, our grouping variable across the different groups is the treatment underscore H5C3 grouping variable. This would also need to be placed into the model as well. And then we would run our analyses just like we're used to. Next, I'm going to show you how to do this in SPSS. So as I discussed earlier, SPSS uses the complex samples module add-on to base SPSS. In order to determine whether or not you have the complex samples module in SPSS, what you would need to do is you would go to Analyze, Complex Samples. And if you don't have complex samples here, you don't have the complex samples module, and you'll either need to get that or you will need to switch to a different program. So if I am wanting to run my analyses in SPSS, I do have the complex samples module add-on. I need to do a little bit of housekeeping before I get ready to actually analyze my data. First, what I need to do is I need to set up what is known as a complex samples plan. I would do this by going to Analyze, Complex Samples, and Prepare for Analysis. Whenever I click Prepare for Analysis, a nice little analysis preparation wizard will then pop up. I would select that I want to create a plan, and then I can type in the file path and name of my plan. One thing to remember whenever I'm doing this is that I need to remember that I need to place my file plan or my complex samples plan into the same file folder as my SPSS data. So what I tend to do is I actually like to click the Browse button instead, and I like to go find the folder that my data is in and then create my plan from there. However, you can type in your file path and name if you'd like. Next, I'm going to hit Next, and now I have to identify my strata and clusters. My strata variable is var underscore stratum, and my clusters variable is my var underscore cluster. Next, because I'm talking about assessing for group differences, my sample weight would be my final sample weight NWGT0. And this would be the same if I was controlling for group differences. Now I want to point out that if I was wanting to assess my entire sample without controlling for group differences, for example, I would need to create an entirely separate complex samples plan. So I could do this, you would do this using the TG all fin weight 0 final sample weight if I was looking at the full sample with no group differences. And you will notice here in a little bit that you have to create a different sample plan depending on which final sample weight you are using. I'll click Next, and the analysis preparation wizard will bring up this next screen, which shows the default selections, which is sampling with replacement and using finite population correction. This is what I want to keep, so just kind of double check, make sure, but those are the defaults, so they should already be selected for you. Now you can either click Next, where you can have the option to paste the syntax if you'd like to, or you can click Finish. Either one is fine. It's whatever you prefer. So now that I have set up my complex samples plan, I'm ready to conduct my analyses to assess for group differences in SPSS. To do this, I would click Analyze, Complex Samples, And to continue with the same variable, seek cancer info, which is a categorical variable, I would choose logistic regression. I would then need to either type in the file path and name of my complex samples plan, or I can click browse, which is what I prefer to do. Whenever I click browse, I can go find the file folder that my SPSS data is in and all my complex sample plans. And as you can see here, I have 4 different complex samples plans that I have already set up for today's webinar. Today, right now, I'm going to be choosing the NWGT0 plan because I am analyzing for group differences. I click open, and now I would be taken to a menu that should look fairly familiar, where I can input my dependent variable, seek cancer info, and then I can put in my factors as treatment underscore H5C3. Then I can either hit OK to run, or I can paste the syntax. Moving along in our little flow chart, the next question you need to ask yourself is, based on the results from the web pilot report or your analyses, you need to determine whether to utilize the total sample or only one group. So if one does find group differences, then the analyst can decide whether to utilize only one group or the entire sample. We do recommend that when possible, you use the entire sample. However, if one does not find any group differences by group assignment, it's recommended that analysts use the combined sample and the respective weights, the TG all weight variables, to increase your statistical power. Note that while it's suggested that analysts use the full sample whenever possible, an analyst may make the decision to conduct analyses on only one group. So now I'm going to go through the code to do that. So if I decide to only conduct my analyses on one group, we can think of a couple of different examples for why this might be true. We might conduct analyses on only one group because we have looked at previous iterations of hints, and we're used to seeing everybody looking or completing the survey using paper only. I might, as an analyst, decide to only look at the paper only sample, for example. So if I'm using only one group without accounting for potential group differences, I would use the TG1 fin weight weights. So now I'm going to walk through that with SAS and SPSS. So within SAS, you will see that the code is very similar as before. We're going to select our variance method, which is jackknife. We're going to select our weight, which in this case is the TG1 underscore fin weight 0 weight. And then we're going to select our replicate weights. Remember how before I said that the number of replicate weights is 50 times the number of groups. This time we're looking at one group, so 50 times 1 is 50. So we should have 50 replicate weights in our replicate weight statement. So we have our TG1 fin weight 1 through TG1 fin weight 50. Our denominator degrees of freedom is 49 times the number of groups, so 49 times 1 is 49. Now we would then put our variables of interest into the seek cancer, or into the model statement. So in this case, seek cancer info, and then our predictors. Then we would do run. Note that in this example, I used the paper-only sample, the TG1 weights. You could instead replace the weight and replicate weight statements with the TG2 weights for the web option group, or the TG3 weights for the web bonus group. Next, to run these analyses in SPSS, we would go and do our complex samples, analyze complex samples, in this case logistic regression because we're looking at a categorical variable, but this time we would choose our TG1 underscore fin weight 0 plan. Now, in this case, you might have not already created your sample plan for TG1 fin weight, so you might need to make sure that you make that first, but hopefully you've already made it because you're ready to go and you knew that you wanted to only look at one sample, and so you can select that TG1 and then run your logistic regression just like before. Now, based on your results from your web pilot report, you should determine whether to utilize the total sample or only one group. You may instead to choose the total sample, and we actually encourage this whenever possible so that you can increase your statistical power. We do encourage using the total sample. So if you were to choose using the total sample, the next question you need to ask yourself is, were group differences found? As Rick already mentioned, in the web pilot results, we have found that there were some group differences between our different experimental groups. And so you might be like me and you have to use the combined sample and control for group differences using the treatment variable. This is using the NWGT weights and the treatment underscore H5C3 variable for the controlling variable. This code is going to look exactly like whenever we were assessing for group differences, except for now we get to put more predictors in. So within our logistic regression, you will see that the code mimics the code whenever we were assessing for group differences, except for this time, instead of stopping at putting our treatment underscore H5C3 into the model, we can then put in our other predictors, which will control for treatment underscore H5C3, control for our different groups, and then also analyze across our different predictors. You can do the same for logistic and linear, and it's fairly similar for linear regression. Next, within SPSS, we're going to go back and we're going to select our complex samples plan as the NWGT0 sample plan. And then our dependent variable will be loaded in to our logistic regression. And then for our first factor, we will put our treatment underscore H5C3, and then our other various predictors would be loaded under factors. So finally, within our little flow chart, you could find that there were no group differences found, and this is actually what our hope is. So in this case, you would use the combined sample without controlling for group differences. The TG underscore all fin weights would be used. Within SAS, this is going to look very similar as you've already seen before, but if there are no group differences found, it's suggested that analysts use the combined sample to increase your statistical power. So here is sample code for conducting a frequency table and chi-square test, a logistic regression, and a linear regression. One thing that I do want to point out is that within the replicate weights, because there were no group differences, we can pretend like this is one group. So in this case, the number of replicate weights would be 50 times one group. So you would have 50 replicate weights. Your denominator degrees of freedom would be 49 times your number of groups, one group. So your denominator degrees of freedom would be 49. Otherwise, your code would be exactly the same. In SPSS, you would need another sample plan that uses the TG all fin weight 0 final sample weight. And you would conduct your analyses like I have discussed before. So next, what I want to do is talk about combining different cycles. We've had several people who have emailed saying that they're interested in combining cycles. I've been asking about the code for this, and so we're really excited to kind of show everybody how to combine cycles across different HINTS iterations. So first, we always suggest that analysts assess for group differences in the HINTS 5 cycle 3 data on your variables of interest. I do want to point out that today's example code and syntax is created assuming that there are no differences between groups in HINTS 5 cycle 3. But if you did conduct your analyses and find that there were group differences found, you need to follow a couple of steps that are slightly different. First, you would need to create a new variable in both data files that would allow the as analyst to differentiate between the 4 different groups. This would be your H5C2. Today I'm going to be discussing combining HINTS 5 cycle 2 with HINTS 5 cycle 3. Then you would need to be able to differentiate between your 3 experimental groups, HINTS 5 cycle 3 paper only, HINTS 5 cycle 3 web option, and HINTS 5 cycle 3 web bonus groups. And you would then create your replicate weights using what we have started calling the Rizzo et al. 2008 method, or the Rizzo method, to create your 200 replicate weights. I do also want to point out that if you're combining more than 2 iterations of HINTS, then you would need an additional 50 replicate weights for each additional cycle. And you would also need to be able to differentiate between each additional cycle in your new variable. So first, to show you how to merge your HINTS survey iterations using SAS, I've provided some SAS code here. The first thing that you need to do is you need to create a format for a new variable to differentiate between your different survey cycles, because again, we are assuming that there are no group differences between within your HINTS 5 cycle 3. Next, you would need to create a new variable to differentiate between the different survey cycles. And then you would run this code. The next thing that you would need to do is you would need to follow the Rizzo method to create your final sample weights and your replicate weights. To create your replicate weights, you would use the array code, and then you would use the if and else if code to create your to adjust your final and replicate weights and create those final and replicate weights. I do want to point out that some people have been combining 3 or 4 different hits iterations to look at trends across time. And so what you will need to make sure that you do is you have separate if and else, more else if statements for each additional hint cycle that you analyze. Within SPSS, you can do this a variety of different ways, but some of the initial first steps are a lot easier to do using syntax. So I have some syntax that's shown here, but you can actually do this using drop-down menus as well. So the first thing that you would want to do is you would need to open up your Hints 5 Cycle 3 data. And then I like to save mine as a new file, my merged file, just so that I can make sure that I maintain my original data and don't mess any of that up. Then I like to rename my data set just so that I can keep everything straight. Then I like to rename then you will need to, rename your final sample weight. So TG all fin weight 0 would need to be renamed as merged fin weight 0 so that it matches Hints 5 Cycle 2 here in a minute. You would then need to create a variable that allows us to distinguish between participants from each cycle. Now, you would then run some code or syntax for the Hints 5 Cycle 2 data. You would do this fairly similarly. You would get your other file, you would open your other cycle's data, you would rename the data set, rename that final sample weight. So for Hints 5 Cycle 2, you would be renaming the person underscore fin weight 0 to be merged fin underscore fin weight 0 so that it matches my Hints 5 Cycle 3 now. And you would create a variable that allows us to distinguish between the participants from each cycle. Now we're ready to run this set of syntax so that we're ready to go. So now we're ready to merge our hint survey iterations using SPSS. We would go to Data, Merge Files, Add Cases. Then I would merge my cases using an open data set, Hints 5 Cycle 2. And then if you have ever merged SPSS files before, you would follow very similar steps as you are used to. So at this point, if you have questions or if you're really getting confused at some point, we definitely suggest users look through the overview of the Hints 5 Cycle 3 survey and data analysis recommendations document. All of the code that I've talked about today, all of the information that I've talked about today is available within this document. But if you also still are having any troubles with your code or if you have questions, feel free to reach out to anyone on the Hints team. Rick and I are definitely able to answer your questions, and anybody on the Hints team is able to answer your questions as well. So now at this point, I think we're running a little bit ahead, so we actually have plenty of time for questions. So that's great. So now we're ready for the question and answer portion of the presentation.
Thank you both for an excellent presentation. As Ashley said, we're going to go ahead and jump into some questions that came through during the webinar. So as a reminder, if you do have a question you would like to have addressed, you can ask it by typing it in the Q&A or the chat panel and selecting all panelists from the dropdown.
Great. So I think I'll jump in here. So thank you so much, Ashley. Well done. I realize that's a lot of information that she gave you. And just to reiterate, as she mentioned, all of the code that she showed, all of the little flow chart, all of that is in that overview document that she just showed. So I certainly would highly recommend that you go there and check that out and give you a nice chance to look at the information. You can copy and paste it into your statistical program and all those kinds of good things. All right, let us jump to the questions. And thank you, Stephanie, for putting those there for me to access. So I'm just going to kind of start running down those. A couple of these, there's some similar questions, so I'll maybe combine across a couple of them to be efficient here. I'm going to start with the first question is, are geospatial markers available in the public use files? So that's a great question. This comes up a lot. The quick answer to that is no. We do not put geocoded variables in the public use files. I'm not just going to stop there because I want to tell you that we do not make it real kind of public information. We do have restricted data files that do contain geocodes. When I talk about geocodes, I'm talking about typically, we're talking about, we know for each respondent the county or the state where they live. For some data, we also have zip code. Of course, those are only for the data files that we use the address-based sample. So again, for certain data files, we will have access to those three geocodes. And we don't make those public for good reasons. One of them is concern about confidentiality, and that becomes a big issue. But if you are interested in using this restricted internal data, as we call it, you can make a request. And the easiest way to do that is if you go to the HINTS website, hints.cancer.gov. One of the menus you'll see it says About. And if you click on that, it says Contact Us. So what I'd suggest you do is you fill that out. It really doesn't require much information, just your name, I think your affiliation, email address. And then again, you can say, hey, I'm very interested in getting kind of restricted data with geocodes. And then basically what happens is we send you a form to fill out that you tell us exactly what you want to do, what kind of, why you want to use the geocoded data. Again, we have some more technical questions about exactly what you're going to be doing. Are you going to be linking data, these kinds of things. And then that gets vetted, that your request. And if it seems like that makes sense, et cetera, then we send you kind of what a data use agreement to fill out that basically says, well, yeah, I'm not going to do anything terrible with the data. I'm going to keep it confidential if I discover anything. So please consider doing that. Okay. The next question, actually I'm going to combine it across two questions. It says, I use the survey package with R. It is easy to read data files into R. Do you have some sample programs in R? And then basically someone asked the exact same question, do you have example code available in R? So the quick answer to that is no, we do not have any example code in that. Of course, we want to be responsive to people's needs, and as I hear more of these interests, hey, I use R, I really love R, I get it, it's open source, it has a lot of capabilities, it can handle both types of variance estimation methods, tailored linearization, and replicate weights, so I get that people really are very interested in using R. And again, as we hear more of a need for that, we will develop that. That makes some sense, and we will definitely consider that for future iterations to provide code. That said, I know R has a very kind of, is open source and has a really nice community of users. So maybe what I'll throw out there is if you have code that you've used with HINTS in the R format, perhaps you could share it with us at the HINTS program, and maybe we can kind of then put that available for other people. Again, in the spirit of everybody kind of working together and again kind of an open source environment. All right. Move on down some questions here. Let's see here. What will be your recommendations for weights if there are differences in predictors for regression? I think, for example, age. So I think the question is, as Ashley was saying several times, the first thing you really want to do is look for group differences. Again, within our three groups, our web bonus, our web option, and our paper-only group. Now, and she alluded to looking at the web pilot report and see, do you see differences there? And in many ways, we're really mostly interested in differences in your outcome. So think of you're doing some kind of modeling, linear regression, logistic regression, whatever it is, and whatever your outcome of interest, that's really where you really want to be looking for group differences. We have fewer concerns about the predictors themselves, but one thing you can do is you can always control for group using that treatment underscore H5C3 variable if you do have some concerns. But really when we're talking about weights, it's really about your outcome. And again, if you do find differences, then you can kind of hopefully follow what Ashley was talking about and how you would use the 150 replicate weights if you do find group differences. And then maybe if you don't find group differences, then you'll just use the entire sample and just use the 50 replicate weights from using the full sample. Okay. Is there any plan to assess the impact of the coronavirus pandemic on information seeking in the next iteration of HINTS or perhaps as an ad hoc study? Great question, and of course, very timely. So the answer is maybe. So we're obviously very interested in that. This is obviously something we've been thinking a lot about. You saw that HINTS 5 cycle 4 is actually in the field. So there's nothing to do about that now, of course. We're already kind of collecting data there. We certainly will be thinking about for future iterations. Now, of course, HINTS, because of its, it has a very kind of rigorous scientific sampling and these kinds of things, it's not so easy to just do these very quickly, like let's say with a panel or something like that. So it's kind of hard for us to be really, really nimble, but we think about, maybe for, as we think about future iterations, if there are still issues involved with kind of the coronavirus or any other pandemic for that matter, we will certainly want to think about that. And can imagine there'd be other questions that would still fit regardless of whether we're in the midst of it or not. So just kind of keep an eye out for that. Let's see. Could you share training materials about or guide me through how to append/merge two HINTS data sets using SAS? Really great question. This is something we definitely want to encourage people to do. We want people to merge the data to do more interesting things with that. And typically, I'm going to actually kind of answer another question. So, I promised to finish this one. And then one question that comes up is, well, why do you want to merge? What are the use cases for that? And there's really kind of two use cases for merging HINTS iterations. One of them would be to look at trends over time. Do you see differences in some outcome over time? Percentage of women who've had a mammogram in the last 5 years, these kinds of things. The percentage of people who feel like their conversations with their doctors are very good, these kinds of things. Has that gone up or down over time? You can certainly do that with HINTS, again, merging HINTS. Or you may say, well, no, I'm less interested in looking at trends over time. Actually, I want a larger sample size. My outcome really hasn't changed much over time, so I want a larger sample size. I want to increase my statistical power. So those are two good use cases for merging HINTS. Now back to the question, well, how do you do that? Well, as Ashley did show you how to merge HINTS 5 cycle 3 with HINTS 5 cycle 2. And that will be found in the overview document that she alluded to. The couple other places I will suggest you look, because we go into a little more detail, is on a couple of reports that can be found on the HINTS website. So if you go to hints.cancer.gov, I think there's a tab there that says something about training materials or reports. And again, we have several statistical reports about how to merge HINTS data sets. We had one from 2005 when we just had 2 iterations of HINTS saying, hey, how can I merge and compare across 2 iterations of HINTS? And then we have a more recent one, I don't remember exactly what year it was, when we had many more iterations of HINTS. And then you can kind of look into more detail there. I think we have an example where we combine, I think, at least 4 iterations of HINTS. And again, we provide code, and hopefully that's really helpful for people to do that. As Ashley was talking about, how you do that is not particularly complicated, but it involves a couple steps. Again, she showed you some of the code to do that, I think, in SAS to do that. And again, the reports that I'm alluding to will have much more detail about that. And again, we've been talking about ways to do that with more than just a couple of iterations of HINTS. So kind of take a look at that. But we certainly encourage people to do these kinds of things. Okay. Actually, that answers a couple of other questions. Another question about R, I appreciate that one. Another question about merging data. And of course, the answer is yes, we want you to do that. Let's see here. Can HINTS data be linked to BRFS data, BRFSS, the Behavioral Risk Factor Surveillance System? So the answer is no, really, as far as kind of a direct, kind of person to person. Of course, you cannot identify a person in HINTS, and so we could not kind of find that same person, let's say, in BRFS or these kinds of things. You just can't do that. But we are always trying to figure out ways of maybe kind of linking data. So again, instead of doing kind of a person-to-person match, there's maybe ways to link, maybe at a geocoded level, potentially with something like the Behavioral Risk Factor Surveillance System, or maybe even census data, for instance. Now, again, that could only be done with the HINTS data that has geocodes. And I talked about that a little earlier, and I talked a little bit earlier about how you would access those data. So, for example, let's say you have the restricted data, and you have a state, the state that each person lives in. Then you could maybe go to another data set, whether that's census, or I know like the Robert Wood Johnson Foundation has a lot of interesting data at a state level that maybe we'll get at things about, percentage of providers or percentage of poverty or these kinds of things. So again, if I know the state, I could potentially link with an external data set to HINTS and maybe look at the effects of that of the environment on behavior. So we have examples of that. That can be a really nice and kind of novel study that can be done, and we definitely encourage these kinds of things. This idea of kind of being able to, by merging or linking data, be able to answer kind of novel questions you can't answer with any one data set. So that's something that, again, we would encourage, but you'd have to have the internal data to do that with the geocodes. Okay, let me see. I'm going to look down here a little bit more. Someone asked about if there's any way is there any way to conduct longitudinal analyses using HINTS? Of course, to this idea that you'd have the same people being surveyed over time. And of course, the quick answer to that is no. Right now, this is a cross-sectional survey of the U.S. Adult population. So these are not the same people over time. However, these are things we are looking into for future iterations of HINTS. So stay tuned. We're kind of looking to see what is possible. Love the idea of having longitudinal data, recontacting the same people over time. Again, that can be a real nice, rigorous way of doing science. So that's something we're kind of looking into. Okay, I talked about geography, so I'm going to skip over that one. Another question about R. I appreciate that one. And we will answer all these questions offline. So I'm going to I'm kind of editing kind of quickly, realizing also we only have a couple of minutes left here. What years of data is included in HINTS 5 or 3? I'm not sure if I understand that question. As I mentioned here, the HINTS 5 cycle 3 was collected in between January in early 2019, and again so HINTS 2 was actually in 2018. HINTS 5 cycle 2 was collected in 2018. HINTS 5 cycle 1 was in 2017. You kind of get the idea there, so that's always kind of good to know. All right, looks like we have time for one more question. Asked about sample code, so that's definitely on the web. Lots of questions. This is great. So maybe the last question I'll answer is: can HINTS 5 cycle 3 data be merged with any previous HINTS iteration? So Ashley showed you how you can merge HINTS 5 cycle 3 and HINTS 5 cycle 2. The answer to this question is yes. You can merge HINTS 5 cycle 3, or really any HINTS iteration, with any other HINTS iteration. So again, that could be cycle HINTS 4 can be back to HINTS 3, HINTS 2, or HINTS 1 for that matter. And the reason we can do that is because each survey is considered as a random sample drawn from the same population. Again, U.S. adults, non-institutionalized, 18 and older. We encourage these kinds of things, especially if you're looking for trends over time. And again, because we have so many HINTS iterations, and it started in 2003, you can really kind of do a nice overview. And we tried to, we will find that there are certain items that are found in every HINTS iteration. That's maybe a small number of them, not a huge number. But again, maybe what you can do is go to the HINTS website, and if you look at our electronic code book, if you look for the items, you can very easily find out which HINTS items are found on multiple iterations. All right, I am going to stop there. And again, we will try to answer other questions and maybe post kind of an FAQ, because I realized I was not able to get to everybody's question. But thank you so much for all that interest.
Yes, thank you, Rick and Ashley, for today's presentation. I want to be respectful of everyone's time today, and we are coming up on 12:30. So again, thank you all for your participation in today's webinar. As it was mentioned in the beginning of the webinar, this presentation will be posted online in the coming weeks. And additionally, we did record all questions that came through today, and like Rick just said, we may be developing a FAQ document that would also be posted online alongside the webinar. So if there were any specific questions that were not addressed today, the HINTS team will be following up, so please feel free to continue the conversation via email. And if you have any questions that were not addressed during today's webinar, you can do so as well. So thank you again, everyone, for your time and participation, and have a wonderful day.